Good afternoon. My name is Jennifer Satchel, and I'm going to be performing a nasal gastric on my patient for decompression of the abdomen. I am in Ms. Lewaski's class, and I am section 10. What I'm going to do is I'm at the nursing station, and I'm making sure that this is what I'm supposed to be doing, and it's for decompression, and that there's no allergies, which there are not. I am going to take my supplies and proceed to the client's room. There I will... Knock, knock.
Come in.
Okay. Good afternoon. My name is Jennifer. I'm going to be your nurse today. I have orders to insert a nasal gastric tube for decompression of your abdomen. I just need you to tell me your birthday.
Martha Jones, 10/20, 1958.
Okay, and I see that you're Miss Martha Jones. Okay, and that's fine. So what I'm going to do today, Miss Jones, is I'm going to insert a nasal gastric tube, and I'm going to put the towel on your chest just to keep your gown. Just make sure there's no spills. Okay, so what I need to do is I'm going to assess your nares to make sure that they're patent, there's no bleeding or anything of that nature. Okay, so what I'm going to do, okay, and I'm going to also check the oral cavity, make sure. And what I need for you to do is, or I'll do it, is hold one nair, breathe in, okay, and do it again. Okay, and there's no occlusion, so now I am good to go. Okay, so what I'm going to do is I'm going to measure to make sure it's right in the right place and everything like that. So I'm measuring from the tip of the nose to the tip of the ear. I'm going to let that hang, and from the tip of the ear to the xiphoid process. Okay, and then with that, I'm going to mark it with a permanent marker. And I will proceed to go on with the insertion. Okay, I am putting on my gloves. Okay, and I am going to lubricate the tip up to 4 inches. Okay, make sure that's nice and lubricated. Don't want no scratching or anything of the nails. So now what we're going to do is we're going to proceed in high Fowler's position, because that's the best position for this. So I'm going to make sure that the patient is holding their head back on the pillow as I proceed, and let them know that it's about to start. Okay, I am going to insert the tube, and with that, I am inserting to make sure that there's no obstruction or anything stopping it, and I'm going to continue to go. I'm going to make sure that everything is fine. Okay, no quelling in the back of the throat. So then I'll proceed to tell the patient to put their head to the chest as I continue to insert the tube. Okay, we're going to do that. And now, could you swallow for me? Okay, that's fine. No gagging or anything of that nature. So now what I'm going to do is I am going to anchor it to the cheek to make sure, so I can make sure that it's in the right place. Okay. So now what I'm going to do is I'm going to aspirate to make sure I have stomach content. Okay. And let's see. And I'm going to test the pH. Okay, and the pH is normal for gastric content. Okay, so now what I'm going to do is I'm just going to make sure and double check it, and I'm going to auscultate. Okay, so I have to pull this back a little bit. And I'm going to auscultate with air. 30 cc's, preferably. Okay, I'm going to rest that right there while I put these on. And I'm going to listen. And I do get the swishing sound. And so then what I would do is I would disconnect this. And I am going to attach the tubing to the gown, leaving enough space so that it can freely move around. Here we go. Let's see. Place that around. Okay. And then we're going to put it to the gown so that therefore the client can move without restriction. Let's make sure it's on there correctly. And it is. And it is enough slack for the patient to be able to move around. And what I'm going to do now is I'm going to attach the suction to the end of the device. Before I do that, I have to make sure that it's in place and get the Y tape. And let's see, okay. This is not my stronger point. Okay, and we're going to turn it around. Bring it around. And, bring this side around. It's really not that fun with gloves on. Okay, and then we're going to take this one off. Don't want the patient having too much tape on. Okay, and now we're going to proceed to connecting it to the suction. And, okay, is everything okay with you?
Yes.
You feeling fine? No discomfort or anything anywhere?
Oh, I'm starting to feel better already.
Okay, well, that was the purpose of this. And I'm going to leave the towel here just, to make sure that you stay clean and dry, okay? Okay, so now what I'm going to do is, after the procedure is done, I'm going to document, which would be the content, how the patient took the procedure, the content of everything, the time, how long it took, reaction, and how much content was out, and my name, initials, date, and time. Okay, so with that, that's how you insert a nasogastric tube.